Good morning and welcome. Today we are very happy to have Dr. Judith Hilton with us to discuss human trafficking and pregnancy, a concern that many of us are confronted with daily in our work. Dr. Hilton received her undergraduate degree from Lenoir-Rhyne University, her master's from UNC Charlotte, and received her doctorate at Duquesne. She currently is a professor at Lenoir-Rhyne University School of Nursing in Hickory. Thank you for being here with us.
Thank you, Mona. When Mona asked me if I would be willing to come and do this presentation, I was very excited and said yes right away. So the title might be somewhat misleading because I think it's really important that we understand human trafficking before we can talk about the issue of human trafficking and pregnancy. So during this presentation, I have chosen quite a few pictures because I think pictures are worth 1,000 words. And some of these pictures are really very haunting, especially if you look at the trafficking victim's eyes. Remember, human trafficking is a global problem. It is a crime against humanity, and it is a public health issue, all of those things. So if someone asked, what is human trafficking? Here are some ideas that I found in the literature that you might also think of as human trafficking. First, modern-day slavery, sex industry, kidnapping, that is often involved, individuals sold by family members to pay off a debt, sexual exploitation, child abuse, forced labor, and a crime against humanity. The actual definition was adopted by the TVPA, the U.S. Victims of Trafficking and Violence Protection Act. They have defined it as the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion. Human trafficking is modern-day slavery. Sometimes we think of slavery as a thing of the past. In Egypt with the Hebrews. We think of African Americans in the South, or perhaps indentured servants in Europe. But human trafficking is a modern-day problem, and it is a modern-day form of slavery. So let's talk about who. Who is being trafficked? Stop and think about that just a moment. There are 800,000 people who are trafficked across international borders each year. 80% are female. That is probably not a surprise. 50% of those females are minors, which I think is a very high percentage and is very scary. In the U.S., 50,000 people are trafficked into the country each year. 400,000 domestic minors are involved in trafficking. But California has the largest number of humans trafficked. The next two are Texas and Florida. When you look at this picture, sometimes we think that human trafficking only happens to other people, to someone else, maybe in another country, of another race, or someone who is not like our family. But it could be your daughter. So we've talked about the who of human trafficking. Let's talk about where. Where does this occur? Let's review some world geography first. On the map, notice where the United States is located, but also notice the relationship of Russia to Asia, how China sits in proximity to Southeast Asia. Sort of keep that in mind. The U.S. State Department has investigated 100 countries and ranked them according to human trafficking. The worst, Russia, which I was surprised to learn. Over 20,000 workers from North Korea are brought into Russia each year. They become slaves and are held in labor camps. I had no idea that North Koreans were being brought into Russia. The next is China, which was not a surprise to me. There are many laws and social issues that contribute to this problem. One is the one-child law, which has caused many unexpected problems. Women are trafficked into China from Vietnam, Cambodia, Laos for wives. Due to the one-child law, women are often forced to have abortions if they are found to be carrying a girl. Also, mass numbers of female children are adopted into other countries. So what is the effect of this? There are not enough women to marry the men in China. So women are being trafficked into China from neighboring countries to become their wives. The 98th is Iran. Women are trafficked and brought in from neighboring countries for prostitution and sex trafficking. Then, if they are caught or found, these victims are punished for crimes of adultery, etc., including being stoned to death. These crimes are often punishable by death. Next is Belarus. It's a very small country, and I was surprised to see how they ranked. It is located between Eastern Europe and Russia. Workers are brought in for forced labor. There are poor working conditions and lots of substance abuse. All of these things, including, if you remember, this was the site of the Chernobyl disaster many years ago, and they have a very depressed economy. Another surprise to me was the ranking of Venezuela. Mostly women are trafficked into the country for the sex trade. Lots of children are trafficked for child sex trade. This, I think, is probably the worst part of human trafficking to me. So what about the United States? We are ranked as number 7 in the world. So does it occur in the United States? Yes, it does, but not in the same, not at the same rates as in other countries. The United States Justice Department estimates that around 14,500 to 17,500 people are trafficked into the United States each year. It is believed that 244,000 children and youth in the United States are at risk for being trafficked each year. So we are ranked much better than other countries, but it still is a problem here, especially for our youth and those who are runaways. Increased rates go along with the increased use of the internet and social networks. Predators are lurking everywhere. So we've heard about the incidents of human trafficking in the United States. Is it a problem in North Carolina? Absolutely yes. North Carolina is among the top 10 states in the United States for human trafficking. Evidently, Charlotte is a mecca for human trafficking. They say that there are 500 new ads for commercial sex in Charlotte per day. Young girls and women are recruited in Charlotte through contacts online. There is a new initiative to help fight this problem in Charlotte with more collaboration between the Charlotte-Mecklenburg school system and DSS. Think of how Charlotte is sort of laid out. There's a crossroads there between I-85 and I-77. They have an international airport, and it's a large city that attracts a lot of visitors. So let's look at a myth. Human trafficking does not happen in the United States, and when it does, it only involves international people. This is false. We now know that it happens in many, many countries. It does happen in the United States, it does happen in North Carolina, and it happens with children who are born and raised here. Here are some more faces of human trafficking. I think these pictures are haunting. Look at their eyes. They almost seem empty. They look lost in time. They look lost and forgotten. Here are some more photos. Once again, you see empty eyes. You'll notice the lady on the right has chains around her wrist. These chains do not have to be real, actual chains. Very often, they are invisible. So why does human trafficking occur? It's mainly money. It is a billion-dollar business worldwide. Men, women, and children are trafficked for forced labor, sexual exploitation, payment of a family debt, and domestic servitude. It often happens to maintain control over the trafficked individual. Some children become child soldiers, especially in other countries. It happens for bonded labor. Trafficked individuals are sometimes tricked by being offered good jobs, places to live. Maybe they'll move to another country where everything will be better. And they're often promised a good education. In some countries, human trafficking occurs because men desire child brides. This, I think, is a horrifying picture. Child brides in Yemen and India. Families believe men who promise to postpone sex with their daughters until she is much older. Families must deliver a virgin to be married. And there was one recent story in the news that one little girl died on her wedding night due to internal trauma, and she bled to death. Another figure I found when I was getting this presentation ready, 42% of women in Turkey are married before age 18. According to United Nations report, 39,000 child marriages take place daily. So what can be done? Report suspected cases when you see evidence with your clients. There is a national human trafficking hotline, 1-888-373-7888. This hotline receives about 473 calls per year. 118 cases of human trafficking have been reported through this hotline. Of the 118 cases, 90 were female, 28 were male, 72 were adults, and 48 were children. There was also, if you remember, a recent story in the news about an airline flight attendant who noticed something wasn't quite right with two of her passengers. There was a young girl on her flight with a much older man. The girl appeared to be dirty, and she seemed very withdrawn, and the flight attendant felt like something was just not quite right, and somehow talked to the girl and passed her a note and found out that she was a victim of human trafficking. When the plane did land, they arrested the man before he got off the plane at that airport. So remember, there's sort of a method that is threefold, is how traffickers work. It is the action, means, purpose model. Their method, they first take action by recruiting, harboring, transporting, and obtaining individuals. Then they have to have the means. How will they get this person to go with them? Either by force, or fraud, or coercion. The purpose may be many different things, compelled labor and or commercial sex trade. I know recently I had also probably witnessed human trafficking and didn't realize it. My husband and I were traveling on I-85 and stopped at a rest stop. Beside us, a white 16-passenger van with hardly any windows pulled in beside us. It was being driven by a Caucasian man, and in the process of my husband and I going back and forth to the restroom in our car, we noticed that he was only allowing 2 or 3 people at a time to exit the van, use the restroom, get back in the van, and then he let 2 or 3 more, and they were all Hispanic. I thought at the time it was odd, but I didn't really realize what was going on. But now looking back, I think that that was human trafficking. There was also another story in the news recently of human trafficking of a tractor-trailer truck that was parked in a Walmart parking lot in the summer, and I believe it was in Texas. There were hundreds of people in that truck that got too hot, and many died. Remember, human trafficking may be for labor or for the sex trade. Some of the top venues for labor would include agricultural workers, domestic work, construction, begging rings, or in the food service trade. Other venues for the sex trade might include pornography, illicit massage parlors and spas, hotels or motels, online ads, or street prostitution and brothels. There are different venues for different purposes. There are health concerns for women that are trafficked, as you can imagine. Very often there's physical trauma. These would include bruises, lacerations, broken bones, broken teeth, contusions, and many internal injuries. Very often they have lacerations due to trauma to genitalia and the reproductive tract. They also very often might enter your practice or come to the clinic because of sexually transmitted infections or pregnancy and miscarriage. Other health concerns might include preterm labor, malnutrition, a lack of health care or prenatal care, work-related accidents, and forced, unsafe abortions. As you can imagine, they probably do not get adequate prenatal care if they do become pregnant, and if they do get some prenatal care, they probably enter care late during the pregnancy. Other health concerns of trafficked women could include mental health issues, depression, PTSD, anxiety, sleep difficulties, suicidal behavior, and panic disorder. Some behavioral issues could include high-risk behaviors such as unprotected sex, early sexual initiation, multiple partners, alcohol, and drug abuse. There also may be fatal outcomes, including death from suicide, pregnancy complications, unsafe abortion, AIDS, murder during rape, and infanticide of a newborn. Even if some of these women and children can be rescued, very often they have poor outcomes because of the lifelong problems they carry from being trafficked and from being abused, as we can certainly understand. We also need to anticipate what their future health concerns may be. They may suffer infertility due to chronic untreated STIs. They may have many urinary difficulties. They may have multiple infections or mutilations due to previous unsanitary and dangerous medical procedures by so-called doctors. They may have infectious diseases like TB, or they may have undetected diseases that go on for many years, such as diabetes or cancer. Many of these health concerns will not show up for many, many years. So how can we as nurses identify trafficked women in our care? Remember that many do not present for antenatal care, especially early in the pregnancy. But if they do come, they enter late in pregnancy and are usually always accompanied by the trafficker. Remember, these men tend to be very controlling and are reluctant to leave her alone in the care of a healthcare provider. They may have STIs and long-term multiple injuries as a result of rape and abuse. Very often these women will appear to be in a state of general physical neglect. They may appear to be dirty. They may even, especially if they are from other countries, they may struggle in speaking English. It may be very hard for you to interview them in care or ask them questions. And when they do give answers, very often these answers may be vague or inconsistent explanations for what has happened. They may also be inconsistent in how they answer questions about their medical history and where they live, etc. When asked if they have regular health care providers, many will not have one. Remember, once again, they may be accompanied by a person who appears controlling and who answers questions for them. They may have old or untreated injuries and give vague explanations about how they received them. We also see this in many cases of women who are victims of domestic abuse. Trafficked women may present with sexual trauma, symptoms of psychological distress, and also may cause themselves self-harm. So you may see trauma, sexual trauma, and it won't be in sync with consensual sex. Very often the examiners will make notations of that. In nursing forensics, medical forensics, they can tell by the angle of the lacerations of the genitalia if that may be linked to forced intercourse. Unfortunately, traffickers are getting smarter as we are getting smarter and more alert and aware. They are now taking trafficked women and girls to smaller, more rural facilities for health care, so they sort of fly under the radar. The feeling is that healthcare providers are more in tune maybe with screening their patients or noticing something being not right with trafficked women and girls. So now they are taking them outside the larger cities to smaller communities for care. We must then be vigilant. So what can we do? The best option is to admit these women and girls to our facilities for further assessment. That will get them away from the human traffic situation, even for a short period of time. We want to provide them with a safe place in our facilities until the issues can be evaluated and a care path can be developed. We need to make them feel comfortable and try to gain their trust and demonstrate a commitment to them. And very often, this will be the first time this may have happened with this woman or this girl. We need to provide nursing and medical care and a social support. If they are not citizens of the United States, we need to help them file new paperwork to be granted with a special designation so they will not have to worry about being deported. And there is a way to do that with the United States government through the National Human Trafficking Resource Center. Now, what if a woman or a young girl becomes pregnant during her period of being trafficked? Hopefully they will enter care at some point, and if they do, be very encouraging and try to build a rapport with her. Do as much patient education and assessment as you can when she does keep her appointments, when she is in your clinic or office, because she may not come back for regular visits. Do not penalize her or embarrass her for late or missed appointments. She needs to have a delivery plan in place early in case you do not see her before she does deliver. When she does deliver, try to keep her and her infant safe. Investigate her situation through appropriate referrals. Once again, I refer you to the hotline. And make sure she is stable before discharge. We need to sort of think about, where will she go when she is discharged? Who will she be leaving with? Who will she be living with upon discharge? And unfortunately, after discharge, many of these women and girls disappear. Often their babies are sold after discharge, and they sort of just disappear. Now, in cases of obvious abuse, we are required to report. Abused and trafficked pregnant women need to be placed in safe houses, battered women's shelters for their safety. Check with the client regarding her other children, the ones that she had before this baby, and check with her about any paperwork she might need or might have. Be most cautious about her whereabouts and report to appropriate authorities if you do suspect abuse. Remember, you're not only treating the mother in this situation, you actually have two clients. Remember the infant's safety as well. Be very watchful for unidentified visitors in hallways and client's room. Keep strict adherence to rules regarding infant bracelets, the security bracelets that alarm if they get too close to exit doors or elevators. Monitor any transportation of infants in the hallways and other areas. An infant's discharge may need to be postponed if there is a suspected case of trafficking, or if you're worried about the infant being sold into the black market or potential infanticide. Report any suspicious activity to appropriate authorities. Other obstetrical or gynecological issues that we might see besides pregnancy. A patient might present with lacerations of the genitalia, the anus, the urethra, or the perineum. Very often, these women and girls will develop fistulas, and we'll see a picture of that in just a minute. It's an abnormal opening, perhaps between the urethra and the vagina, or between the vagina and the anus or rectum. They may also present with abrasions, bruising, bite marks, and contusions. And very often they will have lesions or maybe a vaginal discharge from an STI. Now, if you're dealing with lacerations from a client that has presented, first and foremost, these lacerations need, the new lacerations, or if they are bleeding, they need to be repaired. Superficial lacerations can be treated with steri-strips. Some, if they are more serious, may require surgical repair under anesthesia. Be sure to carefully inspect inside the vagina and rectum for hidden issues that might not be apparent right at first, and always watch for signs and symptoms of infection. Clients with vaginal trauma may present with abdominal pain and vaginal bleeding or hemorrhagic shock. Now, I mentioned fistulas earlier. Once again, they are abnormal openings between the vagina and urethra, or between the vagina and the rectum. These may occur because of repeated rape or childbirth, especially to a very young girl. These are seen in higher incidences in countries where there are traditions of child brides and child marriage. As a result of having a fistula, these women are very often ostracized because of leaking urine or feces, and then they have problems with hygiene and odor, and like I said, because of these problems, they are very often ostracized by families and their communities. Fistulas will not go away on their own. They need to be surgically repaired. Here's a diagram, and the ones that are most common, as you can see, are number 3 and number 2. But they can occur anywhere in the internal female reproductive organs in that area. Other things you might see I had mentioned are abrasions, bite marks, and contusions. It is very, very important when they enter care that you chart the presence of these injuries, and also chart where on their body that you have found these injuries. And very often the charting involves not only the written word, but also diagrams. As you can see, the diagram on the right has sort of a sketch of the human body, and you can use a check mark system and check off the things that she may have or that you may see, but you also need to indicate where on her body you have found these injuries. So these injuries need to be recorded as far as location, grouping, both in the narrative form and also on the diagrams. And certain types of forensic nurses, they are called SANE nurses, S-A-N-E. They use these diagrams when recording evidence for rape cases, and they use a similar system. Some lesions or discharge may be from STIs. These must be identified and cultured. And then once again, once you've identified what the issue is, appropriate treatment needs to be given and made available to the client. And they need to be able to take their prescriptions home with them from the clinic to ensure that they do actually receive their medications. These clients can be easily reinfected due to the perpetrators not being treated. So they might be reinfected with the original bacteria or what have you that they had when they presented the first time. Before we go on to the case study, I have a list of questions that you might want to ask when you are interviewing a woman or a young girl who you feel might be a victim of human trafficking. Some questions you might want to ask might include, what type of work do you do? Are you free to leave your job? Are you paid for the work you do? That might sort of give you an idea that something's not quite right if she says no. Do you owe money to your employer? Where are you living? Are you able to leave your living quarters where you live? Are you always accompanied by someone else? Are there locks on your doors or bars on your windows? Are you allowed to have visitors? Are you allowed to communicate with your family? And then, of course, there are questions that we also use when we are screening any of our patients when they come in, as far as trying to screen for domestic abuse. Things like, have you ever been hit, shoved, pushed, threatened, or forced to do things you did not want to do? All of those are good questions for us to sort of keep in mind that we do need to ask, especially if we suspect human trafficking. So now let's look at a case study. This is Ife. She lives in Nigeria, and she is 12 years old. Ife is a 12-year-old Nigerian girl who presents in your emergency department. You work at a large hospital in the United States. She presents with a broken ulna, multiple contusions, and abrasions. She is accompanied by an older man who identifies himself as her uncle. When alone with Ife, the nurse notices her panties are stained and smell of feces. After some gentle questions, she tells the nurse of being pregnant before and delivering a stillborn baby about 1 year ago. So then she would have been 11. You find out through talking with her that the man is not her uncle, but her husband, due to a forced marriage at age 6, which was arranged by her parents. Upon examination, you find that she has a rectovaginal fistula. Ife states that she was brought to the United States and is now a domestic slave. So how can we help Ife? Stop and think about that for just a moment. As with most of your patients that enter your care in the emergency department, you want to treat her immediate needs first and then move to the long-term things that she might need. So first you will clean any abrasions, lacerations. You will need to set her arm. She has a broken bone in her arm, her ulna. You also need to try to figure out and explore the cause of her incontinence. Remember, you noticed a smell of feces and her panties were stained, which might think or lead you to suspect that she has a fistula. So she needs to be referred for surgical repair of that fistula. Then you need to help arrange post-op care. Will she stay in your facility? How long will she stay? That sort of thing. So you might be interested to know why I was so interested in this topic. And right here are 4 good examples. These are our 4 youngest daughters. 2 of them are adopted from China, and 2 of them are adopted from Vietnam. Before I end this presentation, I did want to explain that when I was doing research for this topic, I found another story, and it was a true story, about Margot Gray. She was sold into the sex slave trade in Kentucky. So it happens anywhere, when she was 5 years old. And the trafficker was someone who was known to her and trusted by her family. She was recently on CNN. She has survived, and she escaped approximately 20 years ago at about age 18. She argues that the focus on catching perpetrators and prosecuting them, she says that's very, very important, but also equally important is giving survivors support that they need. They will have lifelong issues. So there are lots of psychological things to think about. And she, during the time that she was being held, she was injured and became blind. She now has an eating disorder and has PTSD. So you can see that human trafficking does have lifelong effects. Thank you very much. That was short.
Thank you, Judy, for being here today. We really appreciate it. I don't know if that would catch, but maybe at the end. I think that green thing was still on.